All right, there were some fancy shawl dancers there coming to you from Minnesota. And we are Native Nations. Welcome to our June program. We've got two guests tonight, and I'm also, of course, have my co-host, Adam Whiterock. Adam,
hello,
thanks for being here.
I'm back.
And tell us what you brought. We want to mention this beautiful bustle.
Oh yeah, that's my bustle that I put together. I haven't had time to really work on it, but I put it together for a couple events that we did for schools and for performances, and so I'd like to take it apart again and rework on it and make it a little bit better.
Yeah.
Because right now it's just kind of there for me to use when I'm dancing, and I don't really have time. I mean, I'm always busy doing other things, but yeah, I'll get to that.
It looks great. Thanks for bringing it.
Oh yeah.
And our guests tonight come to us from the One Sky Center at Oregon Health Sciences University. To my immediate right, Dr. Dale Walker.
Hi.
Thanks for coming.
It's a pleasure to be here.
And Michelle Singer. Michelle.
Thank you.
Thanks a lot for taking your time out to be with us.
Pleased to be here.
And there's so much to say to introduce these people. I just want to mention a few things about Dale Walker, a citizen of the Cherokee Nation of Oklahoma, director of the One Sky Center and the Center for American Indian Health Education and Research at OHSU. We'll talk a little about that. Dr. Walker is one of two American Indian physician psychiatrists in the nation certified in addictions. He was also recently awarded American Indian Physician of the Year. Congratulations. By the Association of American Indian Physicians. Now Michelle is Dene, Navajo Nation, born in Salem. She is the Communications Coordinator, Public Relations, and Government Affairs for the One Sky Center. Former staff member for Senators Ron Wyden and Ben Nighthorse Campbell, who you should know, and Tom Daschle, South Dakota. And you went to Chemawa? Or you worked at Chemawa?
I worked at Chemawa,
What
yes.
did you do down there?
I worked in the residential area of the school. It's an off-reservation boarding school in Salem. It's one of the 3 off-reservation boarding schools in the Bureau of Indian Affairs system. And my parents met there. They met there in the 50s, and so that's how I came to be born and reside in Oregon. So
My dad went to Chemawa
yeah.
and won the state championship football trophy.
Very nice.
Yeah, back in the day, they had some good football teams down there.
Yes, they
Those
do.
Indian kids from all over the country.
Yep.
Well, Dale, we'll start with you. And I was really surprised to hear that the existence of this One Sky Center. And what is the main thrust? What do you guys, I know you serve the Native community, but in special areas, tell us about it.
Yeah, we've been working with the One Sky Center for about 6 years now. It's a national center, and we work with all American Indian tribes and urban programs about addictions, mental health issues. That's going to, and that includes everything: community issues and problems, suicide, methamphetamine problems, alcoholism, all of the mental illnesses from depression to anxiety disorder and such, and domestic violence. So we kind of cover the waterfront. We're available to all of the tribes in North America.
Great.
And we average 50 reservations a year that we work with, so we're on the road a lot. There's only 6 people in our staff at the One Sky Center, but we indeed reach out across the country. We have a website where we do a lot of our communicating with all of the tribes. All of our presentations and educational activities are documented and put online so that all people across the nation can use it. So we're kind of everywhere, and we're the only shop in town. We're the only ones that do this kind of work.
Does that include Canada?
Yeah. Yeah, we also
Mexico?
have worked, not Mexico.
Mexico.
We do work at 2 different levels, really. We've worked with the suicide issues going on in Canada,
Yeah.
and also some training activities. I guess I should add that too, that we have added a major component now on mentorship, working with Indian folks who are working towards their degrees in health. And so
Good.
it can be kind of any of those areas, but we work with them over time. We have 11 students across the country and 11 mentors across the country, and we
Great.
kind of coordinate that here out of Portland too.
So do these students get college credit?
They are already enrolled in activities. What we do is work helping them towards completing their research and developing their ideas for Indian communities that can receive funding and grants. So we have people who have completed their PhDs and medical training, but they still need that support and development to do American Indian projects in American Indian communities. That's kind of the real theme of that project, and it's really been a lot of fun to start that out.
Great. Now, Michelle, you are the advertiser, right? You want to promote the One Sky Center.
Right.
So what is your main duties?
Well, I just wanted to elaborate on what Dr. Walker had stated about the One Sky Center. First of all,
Sure.
the name is very important. I think it's significant to and resonates with the Native community. The name and the vision of the One Sky Center is in the fact that we all are very traditional, spiritual in our upbringing, our culture, and our beliefs, and the elements of Mother Earth and Father Sky are very important. And the fact that we are Native Indigenous people living under one sky, that's for the most part where the name comes from, the genesis of that. And we do not discriminate whether you're an American Indian or Alaskan Native. We help all folks. And although our focus group is amongst the Native community, one of the key areas that we would like to promote, and our mission is to promote best practices happening in American Indian, Alaskan Native communities in the areas of substance abuse and mental health. And what's been really exciting about the work that we do, that we are engaged in or that we are able to interface with, is identifying and disseminating those best practices that are working in Indian country. For example, the work that we're doing right now with the 9 tribes of Oregon, being able to see what best practices they are doing that are culturally relevant and culturally based, that are working the areas of suicide prevention, combating methamphetamine. Most popular in this area is the canoe journey. You're seeing folks doing canoe journey,
Yeah, it's
powwow,
making a comeback.
right? Talking circles, traditional gathering of roots and berries. There is a component to that really is something that, although to the Western mainstream may not necessarily seem like a treatment protocol, to tribal people that is a part of the healing. It's a part of that wellness and promoting behavioral health. And that's been exciting for me to promote.
Sure.
My role for the most part is to be able to interface not only with Indian country at large, but also other intergovernmental entities, federal government, states, local city, counties, and private sector. And that's been really easy for us to be able to do because it's a very intriguing area that we're working in.
So you have a lot of partnerships with these agencies?
We do actually quite a bit, as Dr. Walker can certainly share with you as well. There is a unique relationship between the United States and American Indian nations, and a lot of federal policy and legislation comes down, and that includes Indian health, specifically behavioral health. And we have a role in which we interface with the United States Congress, the Obama administration, all the way down to states who may have areas of mental health services that interface with tribes in their states. So we have to really make sure that we're engaging and keeping a pulse on that. But also, too, it's amazing that there's a lot of folks that they just don't know how each other's systems work. And so we sometimes are brokering relationships to get people to come together. And so it's been very exciting in the work that we do.
And the whole idea of One Sky is to bring people together, to
Exactly.
realize that what we share in common.
Exactly.
So I really like that part of just the basis of the whole program.
And we have quite of a network, even though we may be small in in-house capacity. Our networks throughout Alaska, through the tribal college and university systems, national, regional, state organizations, tribal and mainstream, have been very helpful in our reach and our, through technical assistance and training, curriculum development. So it's just, we're good and proud to be able to have the working relationships that we do in very geographically far-ranging areas.
Yeah.
We've
that's
been
great.
able to form partnerships with other programs of excellence and programs of opportunity in Indian country, and we have 12 of those groups that are kind of our advisors, and we work with them in their regions, and when our hands are full and we have to kind of get help from the regions, we have people we can call and bring into the problems and work together on. And something you just said about bringing people together, this truly is an integrative model, and a lot of times in Indian country the problems are fragmented. And you don't know how to go and where to go to get help, whether it's, do you go to the Bureau of Indian Affairs, do you go to the Indian Health Service, do you use the state system? How do you put those pieces together? All of them are underfunded.
Mm-hmm.
Yeah.
And so that means that they kind of entrench themselves and don't know how to work together to kind of resolve problems. And so the Indian people are trying to figure out how to get help in this system that's very isolated. And so our big job is to try to break through that and integrate the system to bring resources from all of these agencies to work with the communities. And that's been a challenge, but it's also, we've seen good things happen out there. You heard when we have these special focus projects where we can look at the 9 tribes of Oregon and talk about healthcare amongst that group, and how can OHSU help? How can a medical school and a medical university actually play a role in advocating for the need of Indian people? And we had a tribal summit with OHSU leadership where the leaders of the tribe and leaders of the university were together, and that's a new way of kind of thinking through the process. So.
Great. And I want to hear more about these best practices.
Mm-hmm.
But before we go on to that, some of our viewers, if they're younger, it's good for them to hear how you came up, or where did you start. And Dale, let's start with you.
Mm-hmm.
As where did you grow up? Where did you go to school? What kind of degrees did you get?
Yeah.
A little bit about that experience for background information for our viewers.
Well, we all have interesting paths.
Sure, certainly we do.
And I grew up in rural Oklahoma near a town called Claremore, which is near Tulsa. I went to a one-room school for my first 4 years, one room for 8 grades. Yeah. And it was really quite wonderful because it was both a gathering place for education, but it was the community's place. And so at times you might have the traditional activities of school gathering, Thanksgiving party and Christmas party and such, but you also might have a stomp dance or activities of the tribe. And so we were able to, I think sometimes people don't think about being poor because, you have food to eat.
You don't know what poor is.
You're there, and it was absolutely wonderful way to grow up. And
is this on a reservation?
Well, it's Cherokee doesn't have a reservation. They allotted their lands in the early 1900s, and so they lost their reservation and their nation, and so it was all chopped up into pieces, and then the people lived together. But in my memory, it was a wonderful way to grow up, and it was a wonderful feeling about who you were and what you do. I decided early on about what I wanted to do, and in the 7th grade, I decided I wanted to be a...
Well, it took me a lot longer. Yeah. I still am not quite sure yet, but...
Well, I'll give you some time over at my shop whenever we can talk about it.
Yeah. Sounds good.
For me, it was really, well, first of all, I really liked the physician, our family doctor, and the way that he worked with folks out in the community.
So he inspired.
And I was inspired by his process of working in the community, and I decided I wanted to be a doctor, and that happened early on, and then it was just one incredible person inspiring me after the other, and working with people and contacting people. And so I feel very fortunate that I was able to kind of work my way through, and in all honesty, it was easier then than it is now for kids to kind of find pathways and success, I think.
Yeah,
and
probably.
And then when I did well in high school, and I went to University of Oklahoma. I was a petroleum engineer of all things, and
We won't hold it against
got
you.
myself involved in all kinds of activities, and all the time, though, even with the School of Petroleum Engineering, they knew I was going into medicine, and I was there because that was the best scholarship.
Okay, yeah.
And so after that, it really kind of became step by step, kind of going through a long process of education. But it, as I think we all would agree, it's the journey that brings you there. And if that journey, if that becomes a part of your heart, that becomes something that challenges you and keeps you moving forward. And I think that was true for me. And I always wanted to try to put community activities with medicine and research. And in a lot of ways, I've been fortunate enough to be able to do those things and make Indian research real in the Indian world. That's a very difficult topic to think about, and you have to be there, and you have to be a part of the system to feel that, both in the Indian world and in the university. So you're kind of working in two worlds to make that occur, and that part of the journey has been very, very rewarding.
So what degrees did you get?
Well, I got my first degree in microbiology and petroleum engineering at Oklahoma. Then I went in and got my MD at University of Oklahoma. I did my internship at Oklahoma. Then I was in the Air Force as a flight surgeon for a while, and then I went on to finish my residency work at UC San Diego, and did my psychiatry training there, and then worked at University of Washington for 20 years before I came here for 13. So it's been kind of a series of medical steps, if you will, along the way. The one that I love right now is that for a lot of my career, I've had multiple jobs at the same time, and trying to do my Indian work out of my back pocket.
And
And
not anymore.
now I'm full-time, and I'm doing the work that I want to do.
Great.
And I guess our key, what we want to see happen is we want the One Sky Center to be a permanent, functioning program. That I've seen the value of that kind of reach, and I think Michelle highlights the point of, what do Indian communities need to get better? What kinds of thinking do they need to have about the kinds of treatment and care and support for health care, and social service support for education, for employment, for housing? They all come together. And, it isn't just medicine, it isn't just law, it isn't just education, it's all of those things. And so what I've learned is not only do we bring the tribes together, but we've got to bring the services together. And the community needs to be fully involved in those services. And that's the beauty of the One Sky Center. That's what we are trying to develop and work with across the
Great.
country.
Well, we can expound on that, but first I'd like to hear Michelle's story. Tell us a little about your background,
sure?
Michelle, and how you ended up where you are today.
Well, my parents met at Chemawa Indian School in the 1950s, and my mom is from a small chapter on the Navajo reservation called Manuelito, New Mexico, which is just about 15 miles to the west of Gallup, and my dad's from the Black Mesa area of Kayenta, Arizona, which is in northern Arizona, and at the time they were sent to Chemawa, and it was a 5-year demonstration project by the BIA in which a majority of the students at Chemawa at the old school at the time was Navajo, with a lot of Alaskan Native
Really?
students, yes, and actually some leaders here who are now leaders here in the state of Oregon.
Huh.
So they met, they married, and my brothers and sister and I were born in Salem, and we went through the Salem Kaiser public school system. And I have to give a lot of credit to my sister Marcy, who's 9 years older than me, because she always, she was like a surrogate mother to us while our parents were working, and always ingrained the idea about education. And more importantly, my parents, who although received a certificate of accomplishment from Chemawa, back in those days it wasn't an accredited high school like it is now, so they never really received a high school diploma. So given their challenges with language and coming to a new area and realizing how much we needed to be in value education, it just made me strive that much more. I remember distinctly, I was 12 years old, and my sister took me to a career fair at Chemawa, and I went into the IHS breakout session. And all I remember hearing from one of the presenters was, there is a shortage of American Indians and Alaskan Natives as doctors and nurses, dentists, what have you, and that this was a very meritable area to go into. That's all it took. At that point, I was like, I'm going to be a doctor. And so the next, how many years, I think I just strove to excel in math and science. I went to University of Oregon and graduated pre-med. But by the time I graduated and was involved with so many different activities, I began to realize a shift in my interests. It was definitely looking at education and looking at social sciences. And so I ended up taking a step back from pursuing the medical course and went into education, which is what brought me to Chemawa. I worked there right out of college and worked with probably students not much younger than me at the time. And it was an interesting experience because my parents had went to school there. I grew up around that school and kids from all over the western United States. And although I grew up on and off the reservation, if you will, there was a lot of similarities, the breaking down of family systems, the social economic issues that young tribal people go through, and essentially just a mentorship and a support there. And it really made me think about my upbringing, but also to what was I giving back to, the youth of that time, and certainly the next generation. And so I continued to work in the education field and went to work for 2 tribal colleges, Salish Kootenai College on the Flathead Indian Reservation with the Upward Bound program, and I also worked with Northwest Indian College up at Lummi. And when I was at U of O, I was a part of the ACES organization, American Indian Science and Engineering Society, and when I was at Lummi, I was a co-advisor to about 35 students there at the time, and it really reminded me again how incredible students, and especially in the areas of science and engineering, could be really helpful but also empowering to Indian country if folks pursued those disciplines. And it really resonated with me. I ended up going on to work for the National Organization of Tribal Colleges, AHEC, the American Indian Higher Education Consortium, in Alexandria, Virginia, which is what brought me to the East Coast. And at the time, I was a project coordinator for the Native American Higher Education Initiative, which was a Kellogg Foundation grant that, again, was promoting capacity building within tribal colleges at developing their programs. And so I had a very strong, intimate knowledge of coming from the field different programming and needs. And unfortunately, that was a soft-funded program, so I ended up having to move on. And I was either at the right place at the right time or the wrong place at the wrong time, and came to Capitol Hill. And I started out my legislative career with Senator Wyden. And at the time, I was his very first American Indian staffer, and he had been in the Senate at that time, I believe, about 4 years, and he had come from the House. And at the time, that was a very interesting change, if you will, of, I think, visibility and movement of Indian people on the Hill, becoming more engaging, lobbying, advocating, and it was a good time for me.
About what time?
We're talking in the mid-90s.
Mid-90s.
And a lot of Indian legislation was coming through. Restoration had happened here in Oregon with several of the tribes, a lot of land issues. Just a lot was going on. And certainly health care was one of those issues, and education. And so I managed to find myself at different places, working for Senator Wyden, working for the U.S. Senate Committee on Indian Affairs for Chairman Campbell at the time with John McCain, and then Senator Daschle. And what I realized at that time that was so important was really seeing, as Dr. Walker talked about, the various issues of education, healthcare, natural resource, economic development, housing. Even though issues were separated in these portfolios, they were all interconnected, and a big part of that was health. Environmental health is what I call it. One particular issue affects the other. And sadly, at the time when I was working for the state of South Dakota, there was a rash of suicides that was happening on the Standing Rock Indian Reservation, a lot of West River tribes. And so it really profoundly hurt me and hit me personally and professionally in working on those issues, because it wasn't something you could just do 50, 60 hours a week and leave at home. I mean, those were somebody's family, kids, loved ones. And I kept thinking there really needs to be a concerted effort to raise the visibility of health, behavioral health, the needs, and then also to seeing what resiliency tribal communities were doing to help address their own issues locally and culturally specific. And it was perfect timing to meet Dr. Walker at the time when One Sky was just coming onto the scene, because I could say from my vantage point, here's what other tribes are doing, or this is what some of the policy is, and we really need to, make inroads in a lot of those areas. And so it was a good coupling, I think, at the time for me to come, and it combines my passion for education and for health and raising an awareness between non-Indians and Indians on how to work together, because a big part of some of our work that we do as a resource center is what people don't know, they don't go there, or out of sight, out of mind. And you'd be really surprised how much people have in common when you think about some of the issues if you just took away, whatever stigmas or maybe historical backdrop might be there. And when it really comes down to it, especially in rural and tribal communities, they have a lot more in common if they work together to leverage each other and partner, as opposed to drawing a line and this is your jurisdiction and this is your jurisdiction. It's all the same community. Families, longtime families, schoolmates, basketball partners, you want to help your fellow human being. And so I'm pleased that we get to do some of that work too, to help maybe break down some of those walls or stumbling blocks.
So did you two work together to establish the One Sky Center with your staff, or how did the center actually get started?
Well, the center, I guess, was a part of my thinking for several years before it got started. And I had been meeting with some people in Washington, D.C., especially at SAMHSA, which is the Substance Abuse Mental Health Services Administration. And I ran into a person there who was interested in developing a center, and so was I.
Great.
And so we clicked, and all at once we were able to kind of help develop a proposal to establish a national center.
Yeah.
And when you look around in Indian country, the fact that there aren't resources and there aren't ways of finding out what's going on at one site versus another site. Some people are doing incredibly good work out there, but nobody knows. And so we thought that a resource center would make a big difference in trying to collect all that information in one place where you could start learning from each other about how to make things better and build on what's going on instead of having to reinvent the wheel, if you will.
Yeah.
And so that was the initial concept of what we would try to do, is to gather the information and also provide technical assistance to help tribes continue to work effectively or to change the way they're doing things and work more effectively. Yeah. The suicide issue hit us early on, and a little bit before a time that Michelle got there. Actually, when she's talking about the suicide issues in Standing Rock, she was working still with the government, and we were working on those issues with One Sky, and then we kind of came together, realizing, hey, we can make some things happen here. And so the nice synergy that has come out of that is that the beauty of One Sky also is the fact that when we go visit a tribe that's struggling and having problems, and a negative event has happened, say a cluster of 3 or 4 suicides over a 3-month period of time, that's a disaster in Indian country. Yeah. When that happens to a population of 3,000, 4 people die. It affects everybody in the community. And we've kind of learned, hey, the first thing we do after visiting is calling up the House of Representative person whose reservation is in his or her area. Yeah. And say, do you know what's going on?
Probably not.
And they usually don't. And all at one, and the next question isn't confrontive, it's, would you like us to help you? Would you like to have some help in understanding what's going on out there? Would you like to talk to some of the tribal people that are struggling? Your constituents, the people who vote all the time, and reminding them that Indian people do vote, and this is an important thing. You've got to get out there and do something. Yes. And so that's really become a nice thing. And of course, working with Michelle after she's done a lot of work in Congress, that's greatly helpful to
I'm sure.
to develop strategies.
Her Rolodex is very valuable.
Yes, and the Rolodex here.
Yeah.
So what we've been able to do, though, is to the beauty of that is that we're not federal government employees, so we can advocate. We can talk to people about the need. We can talk about something's got to be done. I can go back and testify on that, and as a physician who knows something about suicide and systems of care, and say, let's get some resources out here. So we can be advocates for tribes. And so I think that we've kind of grown as we've begun to understand we're a resource center, but we provide technical assistance and services. Now we provide advocacy, and now we provide education. And so we're kind of covering the waterfront. And I guess the last thing is strategic planning and leadership development. How do we help a tribe who might be receiving $2 million for health care, for mental health and addictions care, but the tribal council doesn't have the expertise to be able to manage. How do we do this? How do we actually spend the money to provide help and care? And how do we know it goes in a good way?
And you guys have the blueprint for that.
We can help. We can. It is always the community's blueprint. We help find the blueprint.
Okay.
And it's very important that I remember that.
Sure.
I'm a person who, I have expertise and I can provide assistance, but the tribe wins, not Dale.
Yeah.
Well, one of the things just to go ahead.
Michelle.
Sure.
We are not going to take a break as we planned because things are going so good here. I just want to mention to my producer.
Oh, okay, great. Well,
so go ahead, Michelle. I'm sorry to interrupt.
No. One of the things I just wanted to add, which has been one of the great things about having our center located here in Portland, is we have a wonderful cadre of different organizations, local, city,
Yeah, we
state,
do.
regional, national here, and just in Portland. And our center is a part of what we call a Portland Indian Leaders Roundtable, and we partner quite closely with the Northwest Portland Area Indian Health Board, which is the regional representative body of the tribes, and specifically in the areas of health. And they have an epidemiology center, and they also have a policy shop. We work very closely with various department heads in that area, which we're very proud of. A good portion of the behavioral health pieces, they defer to us, or we work closely with them, especially in the areas of policy, suicide, now methamphetamine, which I'd like to touch base on at some point.
And I know they had a good tobacco program.
Exactly.
Yeah.
We have one of the, I think, strongest and most efficient and successful health boards in all of Indian country. And I don't say that very lightly. There's many around the country, but Portland is definitely very strong. Yeah. We work with the National Indian Child Welfare Association, Terry Cross's organization, quite closely. And then there's affiliated tribes of Northwest Indians, and they are the leadership governance regional entity. And I always jokingly say the mothership is the National Congress of American Indians and National Indian Health Board, and we have ties to them. But again, we always try to make sure, even though our backyard is here in the Northwest, we try to work very closely with other regional sister organizations to our own to let them know what's going on out there. And just one of the things I'll wrap up on is we have a partnership with Portland State University's Institute for Tribal Government. They have a nonprofit tribal leadership forum. We do quite a bit of training, not only, as Dale talked about, leadership and development with tribal council, but also too with professional staff. Specifically, what we're seeing here, and this is very odd to say, but in a contemporary context, the modern Indian tribal government is still in its infancy. And we're seeing a new changing of the face of tribal leaders as far as our younger, coming from a variety of different backgrounds, and trying to get them up to speed on the 101s of healthcare, as well as this administration and previous in the last 20 years are really begin to engage tribal governments in a government to government. And so oftentimes that tribal leader has to go in front of Capitol Hill and testify. And so being able to work with them to be able to understand what that all means, we provide that guidance as well as others, the health board in general. But it's sad, since the advent of, or I should say in the wake of 9/11 and bioterrorism and a lot of these other tragedies such as Red Lake and suicide and methamphetamine, what have you, we're beginning to see that tribal leaders and tribal governments are beginning to look at emergency response, community readiness action plans. What happens, what can they do to execute when something like that happens on their reservation? How are they going to be able to lead and be that leader for their nation, in which those tribal constituents, as well as their federal representatives and state representatives, how can they react and work closely together? And we're still beginning to find, I think, tribal leaders getting their legs around that, and so we try to offer the opportunity to be able to say we can help assist in some type of community assessment and strategic plan if indeed they feel it, but it has to be locally driven and led by leadership. And so we've seen some good things happen here, especially in the state of Oregon with our tribes, and I think there's a really good a perspective happening in the Northwest as it relates to our tribes and behavioral health and getting really engaged on those issues.
I had no idea. You guys were doing a lot more than what I could glean from your website. This is great to hear about the other projects and the help that you give to the Native community.
The state of Oregon, I have to admit, has been a leader in this area of maybe met with some mixed opinions as it relates to evidence-based practices happening in tribal communities. There's the only state in the union on its state-ledged books is mandating tribes to their alcohol and drug programs to meet a evidence-based practice standard, and it's been
or not be reimbursed.
Exactly, and that was met initially. I think it was a legislative effort, well-intentioned by legislators, but again, not really working with tribes or trying to figure out what that would mean or how that would look. And the tribes have, for the last 3 years, been working on this legislation to implement and meet the mandate. And they've been doing some really cutting-edge national model work here in Oregon. The 9 tribes, our center, NARA, the Northwest Portland Area Indian Health Board, all working together about how various culture-based best practices happening in tribal communities, how can they, I don't know, I would say, work the nomenclature or how do you document this best practice that will meet this standard? And it is fascinating for me, as a non-medic personnel, to see how a talking circle that many tribal people know is something very, very sacred and very special in our community, and how that could be looked to a Westerner and mainstreamer like, this is group therapy.
Yeah.
But we've been doing it for so long, it's just, or, perhaps, coalition work, task forces. That's community mobilization, or people using language and culture and spirituality, and culture is preservation, and that's looked at, in this particular theory. And so it's really interesting for me and the work that we do in the tribal community, what it means, and it's so important, but also too, there's an audience out there that's having major aha moments, of like, wow, tribal people have been doing this for so long. We've been traditional healers,
Didn't even know.
And didn't even know. So that's been really good work that the state of Oregon and the tribes have been doing together, but there's still a ways to go, but it's going to be an emerging national model.
Great. Thank you, Michelle. Dale, I want you to talk about the American Indian Health Education and Research at OHSU. That's separate from the One Sky Center?
It actually is. We thought about this. The One Sky Center is a nationally focused organization that gathers information, works with people, and is a communications pathway. And we thought about this carefully, that it needed to be nestled within the university in a logical place. And so we created a center, and the center is a center for health, education, and research for all Indian people. It's involved in recruiting Indians into medicine, into healthcare professions, not just medicine, but dentistry, nursing, the allied health field, and so we work to recruit Native students into all of these areas. We try to do a little bit of prep. I suppose we actually do more support for the Center for Diversity Multicultural Affairs at OHSU to help reach out and kind of develop those early tracks to get high school students interested in healthcare professional training and such.
Well, is there any funding you could provide to these students, or is that for somebody else to do?
There is funding available. There are kind of summer scholarships to help put some of the high school students have an opportunity to work with a scientist at OHSU to learn how to do
Great.
some of the work and such, and that's an excellent summer program. And
Yeah, we've got some at our office.
If anybody's interested in that, they could contact oneskycenter.org to contact
And hopefully
us.
your website will be up.
Hopefully it will be up and repaired. And the other thing to do is call the medical school and ask for the One Sky Center, and if you want that number, I can give it.
Or
now
your
or
email
later.
address, maybe,
Yes.
just for the front desk or
Sure.
administrative
Yes,
email address.
indeed. That would be very easy to do and provide. So we do the recruitment piece, but we also have other kinds of, if you will, research projects with American Indian people. We're looking at a project involved in 2 areas of the Pacific Northwest, trying to look at how the process of care and treatment for alcoholism is worked on in programs, and what the cost effectiveness of treatment is within those programs. It's rather important when you stop and think about, how do we spend our resources, in providing care and treatment for all problems. But we know very little about it in Indian country, and so we have projects that are looking at cost and treatment outcome. We also have projects that are working with mentorship, and that becomes another part of the Center for Indian Health Education and Research. We try to keep all of our projects in one place. That way, whenever we are trying to advocate and work with the university, they know what we're doing and they know who to contact.
Good. Good. So that sets the foundation for One Sky to operate with.
That's right. That's our home.
Well, we've only got about 10 minutes left in the show, and I know we need to talk about the real important issues that, well, for me personally, I can tell you, in '94, I lost my stepbrother to suicide. And he had had problems all his life dealing with, I think, he was gay. And because of the societal pressures on non-acceptance of gay people, he just gave up eventually.
Sorry.
And a year later, my stepbrother, his brother, was murdered by his wife after them having a $5,000 a week addiction to crystal methadone. And they ended up getting arrested because they were shooting their rifles in the trees in a park in downtown Echo because they said ninjas were in the trees. And it's clear that, when you take this drug and you're awake for days on end, you just go nuts. That's what I see as just a layman. But what is crystal meth and why is it such a scourge in Indian country?
Well, methamphetamine is a fascinating drug, and it's been around since the 30s. Allegedly, Adolf Hitler used methamphetamine to stay awake and keep alert and follow the war, on his little maps and graphs that he had.
That's what happened to him.
One might, by the way, think about that craziness that you said
right.
as related as well. But you're right. Methamphetamine is a fascinating drug. It's inexpensive to make and dangerous to make. There are as many poisons in the spin-offs if you have a dirty lab that can be very destructive to your thinking and your brain permanently as the drug is itself. And so you've got all of these dangerous things that can happen with the use of methamphetamine. Now, just because we're no longer making as much of it in the little shops around the country, it's all being made in Mexico. Well, do you think the conditions might be better there? Are they going to have scientific labs and people in white coats making meth? I don't think so. I think that it's just as dangerous coming across the border as it was when it was being made in the meth labs here.
Yeah.
So that's number one. The drug itself is incredibly dangerous. The fact that the drug affects your thinking. Now, by the way, let's back up just a second. A person doesn't get hooked on meth because of the bad things that it does. They get hooked on meth because of the good things that it does. And they don't want to see or get involved in the bad things. And so the tremendous positive feelings, the feeling that you can conquer the world, the feeling that you have all this power, the fact that you can stay up at night and the next day.
It helps you to lose
and
weight.
The next night. And for women especially, it helps you to lose weight. And a lot of women use meth, start out using meth as a diet substance, not knowing that it catches up almost overnight.
Yeah.
So it's the positive effects that trick you. And the other thing is that in the first initial 2 or 3 uses of meth, you recover. And so that means, I can do it again.
Yeah, it only takes one try, does it not, to get you hooked?
It is remarkably addicting, remarkably addicting. And whether it's one try or two, if you had a positive experience, it makes you want to try it again. So that's a little hint of an addiction. But then once you get addicted, physiologically addicted, that's a whole other animal. And it is a very powerful drug. Now, I'll tell you this, the only other drug that's known to be more addictive
Tobacco?
is tobacco. So that we need to tell all of our Indian kids.
Yeah, really.
Watch out for these two drugs. They're not what you want to be getting into.
Well,
So-
the thing that I don't understand is that these Indian kids are like when I was in Chiloquin, Oregon on that res, and we didn't do nothing. There was nothing to do on the reservation, and of course, what else are you gonna do? Get in trouble or do drugs? You know, and that's the thing that's not happening enough on the reservation is activities, things that they should be doing. And these tribal people that say they're there for the people and they have all this money, they don't do anything. They don't do anything for our children because they're putting it in their pocket. And I know I love my people very much, but you know they're not doing enough for our children, because if our children were there in front of our elders and their children and then people, then those children have the first thing of and that's the thing that I don't see is that's why Indian people were up here in the cities getting degrees, going to school, trying to help our people. But then this is the other side as well. We're trying to help the reservations and help the people, but they don't want to be helped, or they're already in bad enough shape already. And that's the thing, that when we go there and fight the government, the tribal government, that they don't have to listen to us, And that's why that's that racism between you go to the res, you're gonna make fun of, oh, he's a city slicker, he's a city Indian, and that's the thing, that we don't have communication with each other, because we're coming up here to get a degree, to whatever, to benefit our people, and that's the thing that we're doing, is building programs for like education or activities to keep them busy.
That's right.
And
you couldn't be more right about it. When I go out and visit and talk to communities who've had suicide, nothing to do is the first thing said. That it really is. But then when you listen, there's some other things that are powerful. We're powerless to do anything. We don't have control. And then the most serious thing I hear is we don't have hope. And all of those things go together in that community. And for kids, the first thing that we need to do is to focus on the nothing to do. That is a symptom and a danger signal for loss of control, high drug use, and suicide.
Well, and then also too, what you mentioned and you hit on, and it's very, very real, and it's a whole nother show, is about the identity struggle, that conquer and divide. You mentioned the urban res bit, and who is and what is Indian, and when you start getting into that, especially in the minds of young people in their formative years, that anger, that frustration, that depression comes in, and who are they, or where is their hope, where is their support? And yeah, it's unfortunate that there is that, it's very real in Indian country.
So what best practice would you apply to that situation, Michelle?
Well, again, I think there needs to be a recognition in the fact that these issues are happening. Denial is not an option.
Yeah.
And I think especially to the message to young kids is suicide is a permanent solution to a temporary problem. And the community really needs to come and mobilize around its youth, embrace its elders and that advice, and leadership needs to be supportive. And it all depends on, each community has to derive what works for them, what they want, and are they willing to go the scale to be able to make sure that they are wanting to be well. And it takes a community to do that.
A best practice for this would be community intervention, gathering information, developing a plan, and following it through in light of the children.
Yeah.
The children have to be running the plan, not the cause of the plan.
Yeah.
Well, I would love to discuss this more. And we've only really touched on some of the subjects. So we'll have to have you back on our show some other time, you guys,
Great.
okay?
Great.
because we are officially out of time.
Thank you, Google.
So we want to thank our guests, Dale Walker and Michelle Singer from the One Sky Center. Adam, thanks for your help. And we'll see you next month.